Hey everyone, welcome back to Dietitian Bite. Today, we're diving into an important health topic, diabetes. We'll be breaking down the differences between type 1 and type 2 diabetes, and we'll also cover the common symptoms and early warning signs. Let's get started. What is diabetes? First, let's talk about what diabetes actually is. Diabetes is a chronic condition that affects how your body turns food into energy. When you eat, your body breaks down most food into sugar or glucose and releases it into your bloodstream. Insulin, a hormone made by your pancreas, helps glucose get into your cells to be used for energy. When you have diabetes, your body either doesn't make enough insulin or can't use it as well as it should. This causes glucose to stay in your bloodstream, leading to high blood sugar levels. Type 1 diabetes. Now, let's talk about type 1 diabetes. Type 1 diabetes is an autoimmune condition. This means that your immune system mistakenly attacks and destroys the insulin-producing beta cells in your pancreas. As a result, your body and produce insulin. This type of diabetes is usually diagnosed in children, teens, and young LTS, but it can develop at any age. People with type 1 diabetes need to take insulin every day to stay alive. Some of the common symptoms of type diabetes include increased thirst, frequent urination, unintended weight loss, extreme hunger, fatigue and weakness, blurred vision, irritability and mood changes. If you or someone you know is experiencing these symptoms, it's important to see a doctor as soon as possible. Type 2 diabetes. Next, let's look at type 2 diabetes. Type 2 diabetes is the most common form of diabetes. It typically develops in adults, but more and more children, teens, and young adults are also developing it. With type 2 diabetes, your body doesn't use insulin properly. This is known as insulin resistance. At first, your pancreas makes extra insulin to compensate, but over time, it can to keep up, and your blood sugar levels rise. Common symptoms of type 2 diabetes include increased thirst and frequent urination, increased hunger, fatigue, blurred vision, slow healing sores or frequent infections, areas of darkened skin, usually in the armpits and neck. These symptoms can develop slowly over time, which is why many people with type 2 diabetes may not even realize they have it. Early warning signs and factors. Early detection is key in managing both type 1 and type 2 diabetes. Here are some early warning signs and risk factors to be aware of. For type 1 diabetes, family history is major risk factor. If a parent or sibling has type 1 diabetes, you may be at a higher risk. For type 2 diabetes, risk factors include being overweight, having a sedentary lifestyle, being over the age of 45, having an family history of diabetes, and having conditions such as high blood pressure or high cholesterol. If you notice any of the symptoms we've talked about, or if you have any of these risk factors, make sure to talk to your healthcare provider. They can perform tests to determine if you have diabetes and help you develop a plan to manage it. Conclusion and call to action. Thanks for watching, everyone. Understand diabetes and recognizing the symptoms early can make a huge difference in managing the condition. If you found this video helpful, please give it a thumbs up, share it with your friends and family. And don't forget to subscribe to Dietitian Bites for more health tips and information. If you have any questions or topics you'd like us to cover, leave a comment below. Stay healthy and see you next time.